I'm so excited to be able to be a part of this Spark webinar and lead this discussion around the topic that I have become much more passionate about and have begun to engage in research around. So I'm going to share my slides and get us going here. And what I want to do is really leave an opportunity and time for us to be able to engage in conversation around this very, very, very important topic. Organized. So I start by posing a question. Do issues of implicit racial bias matter in autism? And I'll start by saying that this work is sort of bridging two of my worlds. I was already engaged in some research looking at how implicit racial biases affect the educational outcomes of Black and Brown children who are from more socioeconomically disadvantaged households. So those primarily served in places like Head Start. And I've been an autism researcher and been in the autism community, have family members with autism. So that work had already been happening. I've been an autism researcher for over 20 years. Hopefully some of you are saying you don't look that old. I've been doing it for that long, but it is true. And so this work allowed me to think about the work I was doing around racial ethnic minority children in poverty, and to think about how we should apply some of that research within the context of autism. And so part of what I'm going to talk about today is why. Why should we think about implicit racial biases within the context of autism? And how is it affecting outcomes, or rather disparity in outcomes that we may be seeing? So just to give you a general sense of the flow of the presentation today, first I'm going to talk about what are implicit biases? What do we mean by those? Define them for those who may be less, define that term for those who may be less familiar, and talk about how we know in general implicit bias is related to discriminatory behavior or disparate outcomes. Talk just very, very briefly about some very preliminary research we've done looking at how implicit racial biases are related to the outcomes of autistic children. And then engage in a conversation with you around how can we intervene, what should we think about with young children with autism, in particular children with autism of color, and how we can be addressing some of these issues. So I think it's best to start by hearing, or good to start, not always best, but good to start by hearing from a parent of a person with autism. And I will say, and I would probably go interchangeably between people first and identity first. I know people have different preferences. I'm still getting used to using identity first language sometimes, and I know there's some parents who prefer people first language. So forgive me for going back and forth with that language. But this is a mother of an adolescent now with autism, and I think she helps us understand, or the way she speaks to these issues helps us understand why these issues of race, and in this case, disability with autism, intersect, and why they matter to think about.
I could start with, what does it mean to be a Black mother, period? So for us as parents, there is always an anxiety. I like to say that the feelings, the memory, and the spirit of historical trauma and the story of Emmett Till just lies within our womb, within our soul in the Black community. The fear of a Black mother. I mean, I always say Black folks are not allowed to be unapologetically themselves. They are not permitted to be neurodiverse. And we know this on a lot of levels. So my biggest fear is if an officer approaches my child and my child begins to stem, have to put his hands in his pocket to take out one of the little things he likes to hold on to help him with his anxiety. He's got one of his little trinkets or things that he holds on to and reaches into that pocket to pull it out to calm himself. What's going to happen to my son?
And I think the experience she just shared, I've heard echoed by a number of Black and Brown mothers, in particular adolescent boys with autism, who in particular those who may be nonverbal, have limited language, or may engage in stereotypic kinds of behavior or engage in challenging behavior. the fear that they are more likely to have a negative encounter or interaction with the police, not just because they're autistic, but it's magnified by the fact that they are an autistic person of color. And so this is one of the reasons why we need to start thinking about these issues and how issues of implicit bias, or in some cases, explicit racism, are affecting outcomes. So I like to say one of the longer standing and unfortunately more replicated findings in autism is that we do see disparities across a variety of domains within the context of autism. So a lot of you know likely that we see disparities in diagnosis. Black children continue to be diagnosed slightly later or more likely to be misdiagnosed. So often receiving a diagnosis of related to behavioral or attentional issues instead of a diagnosis before getting a diagnosis of autism. Latino children continue to be under-identified in comparison to white children, also experience a delayed diagnosis. Even after diagnosis, we often find that children of color or children in poverty get access to fewer or lower quality services, are more likely to live in areas where there's service desert. So you have to go further to get access to quality services. They're less likely to have access to coordinated care. And we see that Black families, in particular Black and poor families, are less likely to their kids are less likely to get services after high school. We also have seen some research related to phenotypic differences. There have been some research studies that have shown for some reason we have seen that Latino children tend to show more severe symptom presentation sometimes. And we see from research that Black children are twice as likely as white children to have a co-occurring diagnosis of intellectual disability. So part of what we have to start asking ourselves is, why do we continue to see those disparities? What's maintaining and perpetuating these disparities? But more importantly, what can we do to address these disparities? And I think the information that I just shared within autism, the problem is we try to talk about autism and people of color with autism as though they are separate from what is happening to people of color in general in the US. So we know some things about being a racial ethnic minority in general within the US context. So in general, 60% of Black, Latino, or American Indian children, 60% of those children are more likely to live in low-income households compared to 30% of white and Asian children. So we see class differences that become magnified by race. And we see this intersection of race and class play out in various ways in US society. And people often talk about concentrated or compounded disadvantage, right? Because if you are poor, you are also more likely to live in a more racially segregated neighborhood. If you live in a more racially segregated neighborhood, you're also more likely to have access to lower quality or inferior schools. So you're not getting the same quality of services as folks who lived in higher income neighborhoods. So these are the ways that disparity and disadvantage play themselves out. And what we're talking about, or what people will say are, these are really the roots of what are structural racism. Because we're talking about the differential allocation of opportunity and power to Black and brown children in general. And then you add to that the intersection of race, class, and disability. And we all know that people with disabilities are discriminated against and lack opportunities in a variety of ways. So this is how we have even more compounded or concentrated disadvantage. The other thing we know about US society, right, is that we have long-standing wealth gaps. White households have 13 times the net worth of Black households, 10 times the net worth of Hispanic households. So think about how that plays out if you have a young autistic child. You're trying to get services for them, right? Some families can afford more. They can pay for private services to supplement or augment what they may be getting into school. And we can begin to see how some of these disparities begin to play themselves out even within the context of autism. So we can't separate issues of race and class from autism. We have to understand what's driving that. It's really the combination of all of these things that are likely driving some of the racial disparities we're seeing. Right? And so one of the things we talk about is that people have often multiple minoritizing identities. There are many ways in which society minoritizes people. Race, ethnicity is one. Having a disability could be another. Being LGBTQ is another. I've done some research where we found that adults who are autistic, who identify as autistic and LGBTQ, report having more unmet healthcare needs, more physical and mental health issues than autistic adults who don't identify as LGBTQ. So we see the ways that these intersecting identities can really play themselves out and impact outcomes. And so, as I said, these are really, what we're really talking about are the larger role of societal forces, systemic factors of racism, wealth inequality, residential segregation, just in general, the unequal resource allocation, distribution of resources, goods, and services to some groups, often based on race, can be based on class, can be based on disability, or the intersection or relationship between all of those things. But what I'm going to focus on is more about implicit racial bias, and I'm going to make a distinction. So implicit racial bias is not what we think of as overt racism or interpersonal racism. It's really about the way our unconscious thoughts and beliefs play themselves out and may affect or perpetuate discrimination. So just to differentiate a little bit, so one of the things we've seen in surveys in general in that when we talk about explicit or overt discrimination or racism, in general, we saw trends that the racial attitudes of white Americans were beginning to trend downward. So fewer white Americans were saying things like it's okay to discriminate against someone when they're selling a home. Fewer people were saying that they oppose, someone in their family marrying a Black person, or that they believe that whites are harder working than Blacks. So we began to see downward trends in general in this more overt, explicit racial prejudice in US society. But this is a contrast to how we think sort of implicit biases play themselves out. I'll just give you a brief overview here. But a researcher did a sort of experiment where they had white and Black college students, male college students, who were they attempted to really match them on a number of physical attributes like height, with the difference being the color of their skin. And the other thing they did was manipulate their CV, essentially. They gave them the same qualifications, except sometimes they had a CV that indicated they had a prison record, or sometimes their CV said they didn't have a prison record. And then what they were looking for was who actually got called back after they went on their interview, who was sort of invited back either for another interview or offered their job as a result of that. And what you can see here is that whites without a prison record essentially were, 34% of the time, essentially they were called back. But look at Blacks without a prison record. Blacks without a prison record were called back even less than whites with the prison record. And you can see the difference there between Blacks without a prison record versus whites without a prison record. And again, all things being equal, except the color of their skin. And so the question is, how can both of these things be true? How do we see sort of overt prejudices going downward, but we continue to see these sort of discriminatory actions being played out in job interviews and who gets hired and those kinds of things that may not be, we don't know, but may not be about overt prejudice or racism. And one potential answer, is not the only answer, but one potential answer is that it's more about implicit bias or our unconscious thoughts and actions than it is about our explicit, about overt or explicit prejudicial or racial attitudes. And so implicit biases are really, to some degree, unconscious mental associations of how we link certain social groups, in this case, racial groups, to stereotypic attributes, right? And so implicit biases may lead to stereotypic thoughts. Our biases may cause us to stereotype groups, or our implicit biases may come from seeing stereotypes of groups in society. The thing about implicit biases, though, is that they are normal. We all have them. Everyone has some kind of implicit bias. And they are present even when we try to reject explicit biases. So when we're talking about implicit racial biases, for lots of us, we outright reject explicit racism, overt racial prejudicial attitudes, but we may still have implicit biases, even though we may try to downplay them. And so to sum up, these are really mental associations, sort of the thoughts and beliefs that come to mind when we see certain social groups. They come to mind voluntarily. They don't care whether we agree or disagree with them. But the thing about them is that they can still shape action because they are thoughts, and that maybe can end up being acted on. That's what I want to say there. I can't see any of your faces, but if you look at these images, they may trigger certain thoughts. And then you may go, oh no, I shouldn't think that, or I don't really believe that. But some of these images conjure up certain thoughts in our minds that some of us may then overtly reject and act in a different way. But the idea is that a lot of us have stereotypes about certain people and certain groups that come to mind. Whether or not we act on them is a different story, but they often still come to mind. And so implicit bias really, though, is just a way of how we process information. It is a cognitive processing tool. It helps us to more efficiently process information. It's how we categorize information. It's how we associate information. It's just what our mind does to help us process all the information that's coming into us in society. It's really a form of implicit social cognition. And just to stress again, though, implicit bias does not equal racism. It does not equal racism. Implicit racial bias is one way implicit biases can play out, but we could have implicit biases related to gender or sex, to disability, to body type. We can have implicit biases, or essentially these sort of stereotypic thoughts or beliefs about all kinds of groups. So what do we know, though, from research on implicit bias? One of the things we know is that more implicit racial bias, increased implicit racial bias, that's the increase, is associated with decreased friendly interactions between white people and a Black conversational partner. It's been associated with less positive patient-doctor interactions between Black patients and white doctors. It's been associated with more biased sentencing among jurors and judges, and it's been associated with more discriminatory hiring for jobs. And the other important thing to note here, though, so it can affect behavior or what we do, how people act on it. But it's important to know that while explicit overt racism is associated with education, often we find more prejudicial attitudes amongst those who have less formal education. And there's no real relationship between implicit bias and education. We see similar levels of implicit bias in teachers and doctors as we see in those who don't have college degrees. So again, we all have these sorts of biases, but they can affect behavior. The other question is, are people individually biased, or is the issue that we've lived in a biased society or environment? And so quickly, there's been some research that shows implicit bias aggregated at the county, at the country or state or even county level is often a more robust or stronger predictor of discriminatory behavior than implicit bias at the level of the individual. So that's a reminder that we can't separate context or society from how biases play out, right? That's how stereotypes come to be. We are constantly exposed to these two stereotypic images by virtue of living in society. And we live in a often racially segregated, certainly socially stratified society. We often live near people who look like us, who make a similar income as us. So what the top graph there shows, though, is that in countries where there's more bias towards men, that you see better scores from men on science tests in grade 8. The bottom graph there is about implicit racial bias. So in states where people are more likely to make an association between Black people and weapons, we see more disproportionate use of lethal force by police towards Blacks. So it's another way we can look at how implicit bias sort of plays itself out to actually have an effect on outcomes. The other thing we know from other research is that implicit bias at the state or county level has been associated with larger health disparities in cardiovascular disease, larger race disparities in infant health, larger race disparities in upward mobility, so who gains wealth, more Google searches for racial slurs, more residential segregation, and more school segregation. So we can see, again, that context, society matters, and these things play themselves out in terms of disparity. So thinking back to the racial ethnic disparities we see in autism. So how is implicit bias measured? One of the reasons we can look at implicit bias at the state or country level is that there's a Project Implicit maintains a database of the implicit association tests. Anyone can go online and take that test. It's free, and lots of people around the world have, and you can get access to that data. And you can look at implicit bias in various places and how they're associated with outcomes. But these are computerized tests that are really happening in microseconds, where you're seeing images and sort of you're associating those images with words, right? Like male versus female, and then who do you think of as emotional? The other task, it was developed by a colleague of mine, Keith Payne at UNC Chapel Hill, that I won't go into, but it does a similar kind of thing. So we pull some data from Project Implicit to really look at county level implicit bias and how it relates to outcomes. But before I show that, I want to show one more slide of why this matters. So this is a paper by my colleague Keith Payne at UNC. And then they did a paper looking at the relationship between the number of slaves in states in 1860. And they chose 1860 because that's the first year that slaves were counted in the US Census. And so obviously we all know history. Slaves were concentrated in the Deep South. And they looked at the association between slaves in 1860s and current level, present day levels of implicit bias in the US. And what they found was the higher concentrations of implicit bias in states that had more slaves in 1860. Right? And so the question is, why? Why would you still be seeing an association between the number of slaves in a state in 1860 and what implicit racial bias looks like present day? And so what we think sort of maintains that bias, right, are sort of these historical markers, right? We really talk about built-in structural inequality or racism, right? That has led to ongoing kinds of policies like Jim Crow and segregation that we know were also concentrated in those states. Often those states still have high levels of residential segregation, high levels of concentrated poverty amongst Blacks. And so these sort of still historical markers of segregation are manifesting into stereotypes and how implicit bias is continuing to play out in those same places present day. So, we can think about So even though implicit bias isn't synonymous with racism, when we're talking about implicit racial bias, it's likely that we see high levels of implicit bias because they are affected by, or they are the result of, sort of factors that we think are associated with more systemic forms of racism, or deep ingrained racism that continues to exist today. And there was a study that another group did looking at implicit bias and how it plays itself out in autism. And so I think it points to why we should care a little bit. So this group had college students, Black and white college students. They randomized them to read vignettes, look at vignettes that depicted an autistic child. And sometimes those vignettes were paired with a picture of a Black child, sometimes a picture of a white child. And sometimes, I should also say, sometimes the vignettes were describing an autistic child, sometimes they were describing a child with conduct disorder. But again, those vignettes were paired with a Black or white photo. And what they found was within group racial bias, which we see play itself out in different ways. So white college students were more likely to associate autism with white children and conduct disorder with Black children, where we found the opposite for Black college students. They associated autism with Black children and conduct disorder with white children. But think about if most of the diagnosticians and clinicians are white, and there's this natural tendency to associate autism with whiteness. What does that mean for diagnosis? And maybe it helps us understand why we continue to see misdiagnoses or delayed diagnoses amongst Black and brown children. So one suggestion, may not be the only reason, but I think it's important for us to think about these things and test these things and understand if they are the reason we see some of these disparities. And so we did a little bit around implicit bias, looking at counties within Kansas. And yes, Kansas is somewhat diverse. I moved here from the Southeast, so I'm actually a Virginian, but I now live in the Midwest. But this is implicit association IET data that we pulled at the county level. And darker shadings of sort of that purplish there means more implicit bias. In this case, it's pro-white racial bias. The gray areas there, what that means is that not enough people in that particular county went online to take the implicit association test. It doesn't mean that implicit racial bias doesn't exist in those counties. It's just that we don't have enough data to pull from those counties to look at this. And so we ended up with a sample of 81 Black and Latino kids and 107 white kids. And these were kids who were diagnosed through the Med Center at University of Kansas Med Center. And they were between 24 and 17 month olds at the time they came in, and they went on to have a diagnosis of autism. And what we found in terms of how county level implicit bias was related to sort of these individual outcomes we saw for these kids is that more pro-white bias was more likely. That meant that the kid, this is actually for Black and Latinx children, these particular data here. So Black and Latinx children were more likely to be referred by their school system in counties with more pro-white bias. They were also more likely to have an IEP. They were also more likely to be getting school services, but that makes sense since they had an IEP. But Black and Latino children were less likely to have a primary care provider that was a pediatrician in counties with high levels of pro-white bias. So these are associations, understanding relationships. The question is, what's the reason for these associations? And there are all sorts of intermediate factors between what we know happens at the county level and what happens at the level of the individual child. But this is helping us understand to some degree that we do see some of these associations between sort of these more global indicators of implicit bias and how it plays out with individual child outcomes. And so I think the question I want to have us engage in a discussion around is, what can we do about implicit bias? That first sentence there, people have gotten mad at me about all interventions to change implicit bias have failed. And it's really because we see short-term changes often if you try to intervene upon implicit bias. And that's because implicit bias itself isn't very stable. your attitudes or your implicit or your conscious thoughts about a group on one day could be different than the next day. Let's say today you spent all your time around sort of engaging with Latino children. You live in a Latino neighborhood. So going online and taking a test about implicit bias around Latinos may be different on the day you did that when you move to a month later and you live in a different kind of neighborhood with a different racial ethnic configuration. So we are shaped by society and by exposure to people. And so implicit bias itself isn't very stable. So that's why it's hard to measure change or capture change. It doesn't mean we can't change people's attitudes at all. Another thing we know, though, and I think this is with breaking down or dismantling structural racism, is addressing implicit bias, is that some of this does call for shifts in policy sometimes. One of the things that was found is we saw that anti-gay implicit bias decrease after same-sex marriage was legalized. And we saw in states that had already gone on, that had legalized same-sex marriage before it was formally upheld by the Supreme Court, that those states already were seeing declines in anti-gay implicit bias because of larger scale policy changes, which changes attitudes, right, and acceptance of our thoughts and beliefs about certain issues. So some of this may take some changes around policy to really fully address some racial and ethnic disparities that we see within the context of autism. Reimbursement rates related to diagnosis, training, ensuring that we have more diverse workforce, both in schools and also in healthcare centers where kids and families may be seen. So just in conclusion here, we know that racial ethnic disparities in autism persist. These disparities, though, may reflect larger structural inequalities in society, including how those structural inequalities play themselves out in terms of implicit bias, and that the solution to these disparities may take more, likely will take more than just changing the individual to really address disparity. I just want to thank a couple of my colleagues, Keith Payne at UNC Chapel Hill, who's really an expert in implicit bias, and Anna Wallish, a postdoc who works with me around some of these issues. So thank you for taking the time to listen to me today. Jabril, I think you're muted still.
Oh, I'm sorry. I'm sorry. Thank you, Dr. Boyd, for your awesome presentation. A lot of informative information. We have a ton of questions. So we are going to enter into the Q&A portion of tonight's discussion. If any of our attendees have questions, just go ahead and continue to submit them in the Q&A box. The first question I will start with is based off a comment that we received during your presentation. And it made me wonder, what do you recommend we do when faced with microaggressions from our providers and school districts that are supposed to help us and our children?
Yeah, that's a really good question because we've often all faced them, right? I think we have to talk about, right? I think we shouldn't be ashamed or afraid to talk about those things, and that we see it as a form of microaggression. We don't have to use that word because not everyone understands it, but it's okay to say, I'm receiving that information a little bit differently because of who I am, right? So let's talk about why I'm receiving that information a little differently. I don't like to believe that everyone is trying to act in a way that's offensive, and sometimes just informing people and giving them knowledge is a helpful thing and people will change their behavior. But I think we have to be okay with calling it out when we see it, right? And informing people how that makes us feel, how that's affecting us, right? And I think the other thing that, I'm not a parent of a child with autism, but one of the things that's always been most powerful to me when I talk to parents is when they center their children. When they come to IEP meetings, they said, we're all here because we want to help my child. So recenter your child. Like, we're both here, we're both in this space because we want to help Johnny or Gabriel or Tyrone do better, right? And so how can we both work together to improve outcomes? So I think, we center the child in it too, that it's not an adversarial relationship. We're both trying to work for the same place. But let me help you understand why I interpreted what you just said or did this way.
Thank you. And our last question was on microaggressions. So we received a question. Can you define microaggressions and give us an example?
Yeah, so microaggressions really, the questioner might the person who asked it might have a better answer to some degree. It's really the more subtle racial experiences or encounters that we may have. And I think it's best to give an example to really define it. It's like me as a Black man getting into an elevator, and all of a sudden the person, let's say a white person there, moves all the way to the other side, or being followed around in the store, or having someone say something to you in the workplace that sort of questions why you're there or how you ended up in that space. So it's more subtle forms of, often we see racial, ethnic, almost stereotyping in some way, and really how those affect us. So it's not explicit racism that's being done. It's really these sort of more subtle forms of entrenched stereotypes of beliefs that get played out to some degree.
Thank you. How can or should systems of care address racial biases to combat disparities in autism diagnosis and access to services?
Yeah, that's a really good question. I think I think health inequity in healthcare plays itself out in lots of ways, right? So one, it plays out in access to care, like who gets access to care. The other is it plays out in the kind of quality of care people receive. So we want people to get access. We also want them to get quality. And I think there are lots of just general recommendations. One is, can we have a more diverse workforce? That may be a helpful place to start. It's just diversifying the healthcare workforce and who people are interacting with and getting access to. And I think there are other things we can do around training people. We know we can do things to improve healthcare provider patient interactions. We know in general that white doctors tend not to ask as many questions of Black patients. And so we can change those kinds of things, right? We can change perceptions. But I think one basic strategy is think about how we can better diversify the workforce and train the current workforce to be more race conscious, to be honest, right? Like to understand that people have biases still in 2021 about who they think has autism. And it's not sometimes just about race, sometimes it's about class, right? That there are certain families who are more likely to have kids with autism, in particular kids with autism who don't have a co-occurring intellectual disability, that these stereotypes still persist. And for a lot of you who are family members or who may be autistic, they may not persist for you because you were exposed to it, but they do persist sometimes for healthcare providers who aren't exposed as often to people with autism or families of people with autism. So sometimes they're still holding on to stereotypic beliefs about what autism looks like or should look like. And that affects diagnosis, it affects treatment recommendations, not just healthcare providers, school providers too, right? So it plays itself out in the education space as well.
So before I get into the next question for the audience, I just wanted to define BIPOC, B-I-P-O-C, and that means Black, Indigenous, and other people of color. Our next question is, what kind of policy changes do you think need to happen to remediate in services that exist in communities with more BIPOC?
Yeah, it's a really, really, really good question. I think, we have to think about it's broad policy changes. It's a complicated question, right? Think about the healthcare system in general, right? We know if you have private insurance, it makes a difference, right? So what about families of kids with autism who don't have private insurance and can't afford things? So how do we think about Medicaid reimbursement rates, or how Medicaid reimbursement works to some degree? And are there policy changes we can make related to it so that it works for all families? So you get qualified, you get access to similar kinds of services, you get similar amounts of ABA, not saying it has to be ABA, but whatever the therapy is of choice. In school system, it's going to take broader policies, right? Schools are often funded in these public school systems based on zip codes. So if you live in a high income area, your school gets lots more funding because of taxpayer dollars. So how do we reallocate dollars to schools, to impoverished schools where poor kids with autism are being served and aren't getting access to the same services? And I know it's hard for us to, well, first of all, the autism community does know how to advocate for policy changes, but these are going to be policy changes that don't just benefit people with autism, they're going to benefit people of color in general, because there are disparities that we can't ignore that play out for some communities over others. But by addressing broader disparity, they'll address also help elevate people of color who are autistic as well, right? So, but we also have to think about how disability policy may be affecting some of this, and what changes do we need to make to some of the policies around disability. So it's going to take some policy changes, but I think on an individual level, we could do more to train people and to diversify the workforce. And there are more things we can do at the level of the individual for those of us who aren't comfortable advocating for policy changes. It's going to take a whole of system approach. You don't dismantle biases or these kinds of complex issues without thinking about how we change the system.
Next question. Have you found that there is a discrepancy in access to behavioral support for autistic children based on race?
So I would say I personally haven't found that, but I think people have found it via Medicaid claims data in terms of the kinds of services that we see in particular Black kids get in comparison to white kids. So we've seen it play out in some way. And I've certainly heard it talked about anecdotally. So I think there's some evidence that racial minority kids, in particular Black and Latino kids, get access to fewer services. And we also see then that interacts with poverty in general, that poor kids get access to different kinds of services. So I think we do have some data or some information that speaks to disparities in services.
Okay. We have great questions coming in. The next one is, how do we get health providers in school districts to work with ethnic minority parents to coordinate services to fit the needs of the individual child, thereby reducing disparities experienced by children with autism in health and education systems?
Yeah, wow, that's a great question. These are all great questions. I love this conversation. Yeah, how do we get people essentially to listen to us, to see us as also advocates who want to be there to help support our children, but to understand that there may need to be some individualization because of differences, racial, ethnic differences, or others. I hate to be a broken record here, but I think it comes back to how we train people before they get into these systems, because systems often operate to maintain and perpetuate disparity. So we need to train them before they get into the system. I think we, unfortunately, as we all know, we have to keep showing up and advocating and organizing, right? Organizing with other parents who are facing similar circumstances, and talk, and really to some degree there's power in numbers to say, hey, look, this is an issue that this group of families is facing. How can we come to a solution around it, right? There's some good old-fashioned organization that can happen, but we unfortunately have to keep showing up and advocating. But I do think it comes back to how do we train a more culturally competent and culturally aware workforce around some of these issues in general.
Next question. Awesome. Thank you. How do we reduce implicit bias regarding diagnosis of autism between boys and girls by health professionals and school districts? Unless moderate, autism presents differently in girls and boys.
Thank you so much for that question. I'm so glad everyone was listening. Yes, because implicit bias plays themselves out in different ways, right? I talked about implicit racial bias, but as I showed from that graph, you can certainly have implicit gender bias. And there is likely some implicit bias around boys having autism and not girls, right? And that affects the time girls being diagnosed, and maybe why we seem to be continuing to have under-identified girls who don't have a co-occurring intellectual disability. And so I think we need more exposure of diagnosticians and clinicians to females with autism so they get a fuller picture of what it looks like. So they aren't hanging on to stereotypes and unconscious beliefs about autism being a male-dominated disorder. Yes, it is, but females also have autism. And so I think we need more exposure. Let's be honest, we probably need more women well, there are a lot of female psychologists, but in terms of pediatricians who are being seen. And so again, I think it's another way about diversifying workforce in terms of gender, but I think part of it too here is more exposure to females on the autism spectrum. So they get a fuller picture of what autism looks like. As we all say within the autism community, if you see one person with autism, you see one person with autism. The problem is a lot of people only see one person with autism and they think they have a picture of what autism looks like. So I think more exposure, more awareness is a really good thing. I think in terms of helping with the gender bias we see as well. So great question.
Our next question. What can we do to find access to help and serve in service for our adult population that have been hindered by the actual policies?
Yeah, oh gosh. That's a great, I'm sorry, what was the first part of the question, Jabril?
What can we do to find access to help and services for our adult population that have been hindered by the actual policies?
Yeah, that's a great question. I do some work around adolescents and have been involved in some work around sort of post-high school, and we know it's been talked about in the literature, there's often a service cliff. Folks lose access to lots of services. A lot of autistic young adults unfortunately end up sitting at home for lots of reasons. I don't do this particular work, so I'm going to quote other people in this and the work of Paul Shattuck and others. And what I've learned from talking to those folks is that part of the issue here is also a system issue, right? The mental health system doesn't talk to the intellectual disability system. There really isn't much of a system for people with autism who don't have a co-occurring intellectual disability post-high school. People like to send them to the mental health system. Mental health system said, we don't really do autism, you need to go see the ID system. So we see that systems don't interact, aren't set up in a way to really coordinate services, to coordinate access, in particular, once folks leave high school. So how do we improve systems? How do we have a more coordinated system of care? Unfortunately, we just don't have a great way to do it. I know in talking to so many parents that the burden really falls on you, as it has from when you first got the diagnosis, to be the coordinator of care. And systems get even more complex in adulthood because there are way more systems with which people have to interact often to get services. It's a little less complicated within schools to figure some of this out, to speak to the speech pathologist versus the teacher. But once folks are out of school, systems are operating through different channels and mechanisms and departments and states. So it gets more complicated. But I don't think I have an answer, but to tell you that the problem is a systemic problem, is that there's a system problem that often is preventing or really impacting coordinated services and care. And we have to have some systems change happening to really address that. And it's going to take some policy changes, I think, to best address it. But how do we create medical homes for adults so there's more coordinated systems of care? So I recognize it is a real issue and a real challenge. And how do we help autistic adults better self-advocate for those services and navigate those systems as well too, I think is another big piece of it.
All right, our last question. What can we do for our children now?
What can we do for our children now in general? Well, for those of you who showed up, you're probably doing all the right things, right? I mean, I don't, this isn't one way. I don't think we have to separate autistic children from neurotypical children. What we know in general about development is that all kids need access to what is called a stable and nurturing and safe environment. And we know that to be associated with positive outcomes, to be a source of resilience, even for children who grow up in difficult circumstances. So what you can do for your kids is to continue to provide them a safe, stable, and nurturing environment.
Absolutely. Thank you so much. So that is all the time we have for today's webinar. Thank you so much, Dr. Boyd, for an amazing presentation, an amazing engagement with our audience. Thank you for all of you who joined us tonight.